Number one drug TTC mothers misuse is Clomid, and most of the time, most women get the desirable results, while some women, that positive results they wanted, they don't get it. And this is because of how they make use of this drug. This is because of how they use this drug, when they use it, and the amount, the dosage of the drug that they use. So let's talk about Clomid in this video. We are going to be talking about what Clomid really is, because most women don't know. They just ask their neighbor, oh, I've been trying for some days, and the next thing they think about is to go get Clomid. We are going to be talking about what Clomid is, when you can use Clomid, who is this medication for, and who cannot use Clomid. All of these things we are going to be discussing it in this video. Hello, my name is Blessing and you are welcome to my YouTube channel. On this channel, I film content related to health and my lifestyle. So let's get into this video quickly. So what is Clomid? Clomid is an anti-estrogen medication that is being prescribed to you in order for you to get pregnant when you ovulate regularly. This medication helps to increase some reproductive hormones in your body, like the LH and the FSH, the luteinizing hormone and the follicle stimulating hormone. Now, these two hormones is responsible for your ovulation. Remember, without ovulation, it is almost impossible for you to get pregnant. And some women don't ovulate, and that is when this medication is being prescribed. So you need to be sure that your infertility is due to you not ovulating. You understand? Because when you take this Clomid, it actually helps the body to produce this LH and FSH, that is these two reproductive hormones that I have mentioned. Remember, your ovulation is when your egg is being released. That egg that your partner's sperm cell is going to, fertilize. That is the egg that is being released during your ovulation. Now, these two hormones is the one that helps that egg to mature during your ovulation and makes it to be released into the fallopian tube during your ovulation. So in simple terms, it means that without this hormone, or with low level of these two hormones, the LH and the FSH, there will be no production of egg during your ovulation. There will be no production of egg, and because of this, there will be no release of egg. And if there's no egg, the sperm cells cannot fertilize anything. This is where Clomid comes in. So how do you use this Clomid? Disclaimer, before I continue this video, remember that you cannot just go to the pharmacy and purchase this drug. This medication needs to be prescribed because it needs to be monitored. Your physician or your gynecologist is going to know when he or she is going to increase the dose or reduce the dose, and also able to monitor the side effects, because yes, it comes with side effects. This medication comes in tablet form. It is in tablet form and it comes in 50 milligrams. And this tablet can be taken as a 5-day treatment cycle. Now, remember, in order to take this medication, it depends on your menstrual cycle. And a lot of women don't even know how to calculate their menstrual cycle. So if you don't know how to calculate your menstrual cycle, I have a video on my channel where I talk about how you can calculate your menstrual cycle. So I'm going to link the video down below in the description box so you can watch it after this video. So the number one mistake people are making is taking this medication on day 5 of their cycle. Most people think that on day 5 of your cycle is when you should use this medication without even knowing what their cycle length is. I know most people believe that, their menstrual cycle is 28 days. Because yes, as a lady, we do have our menstrual cycle length. Some ladies have their own as 21 days cycle, that is short cycle, while some have like 30 days, which is the long cycle, or even 35 days long cycle. But average women have 28 days, which a lot of women mistake that and think that every woman should have 28 days cycle, which is not true. A lot of men have 21, 28, 26, or even above 30. So it depends on your cycle. It is those women who have 28-day cycle that can take this medication 5 days to their fertile period. With this, one size does not fit all, my darling. So you see, this is why maybe you just take it blindly without knowing your menstrual cycle. Of course, you're not going to get that positive result. When you know your menstrual cycle and you know what day you are actually taking this medication, so when you start taking the medication on the 5th dose, that is maybe you've taken it from day 1, like from the 5th day to your cycle, you've already taken it up until 5th dose. So on the 5th dose, it is expected, it is advisable that you have unprotected, consistent intercourse with your partner. If possible, you can have it every day till your ovulation day. Even if it is alternate days, it depends on you. So if you do it every day, why not? But if you do it every other day, it is also okay. Another thing you need to know is that this medication is not suitable for all women. That is, it is not all women that can take this medication. You see, taking this medication, you need to be extra careful. It is important that you speak with your gynecologist before you even start taking Clomid. Now, if you fall into the category of people I'm about to discuss, then Clomid might not be for you. Number one is if you don't know the cause of your infertility. If you don't know what is making you to be infertile, you're not sure if it is your hormonal level, you're not sure if it is as a result of other gynecological condition, or even it is from your partner, maybe you are not even the problem, or it is your partner that is the problem, then this medication might not be for you. Also, if you are already pregnant, then this medication might not be for you. So speak to your gynecologist at all times before you even take any medication if you are pregnant, because at this point your body is fragile. I know some people will be like, oh, I took this, nothing happens to my pregnancy. I always tell people that even if your neighbor take particular thing during a pregnancy journey and nothing happened, you cannot compare your own body with another woman's body. It is totally different. So make sure you speak to your midwife or your gynecologist before you take any medication at all during your pregnancy. Also, if you have hormone dependent tumor, so this is the type of cancer that get worse by hormones. So if you have this condition, then this medication, this Clomid, might not be for you. Uterine fibroid or ovarian cyst, this medication, you might not be able to use this medication. And even if you have liver problem, if you are taking other medication or herbs, it is important to speak with your gynecologist because of counter reaction. You don't know which one can react to each other. Also, if you have blocked fallopian tube, then you have no business taking Clomid, because even if you are producing the egg, then there's no way the sperm cell can able to fertilize the egg. This is because the fallopian tube is blocked, so there's no passageway, there's no way the sperm cells can pass through the blockage to fertilize, the egg that is being released. So you have no business taking Clomid. Instead, speak with your gynecologist for other solutions that are available for you. Side effect of this Clomid is that you might get pregnant with twins or multiple pregnancies, like triplets, like quadruplets, and so on. And this is because of the stimulation effect of the Clomid. And this is how this happens. When this Clomid stimulates the ovaries can release more than one egg. Like it can even release 2 eggs or 3 eggs or more. And because of that, the sperm cells are able to fertilize. The sperm cells can fertilize more than one egg. And this is because per ejaculation, men releases millions of sperm cells. And this is possible because sperm cells can actually fertilize more than one egg. And as well, you may feel flushed. You may also experience like abdominal cramp, nausea, and even headache. So it is important that you speak with your gynecologist when you start feeling these symptoms that I have listed, so that you can be reviewed and the dosage can be reviewed as well. So above all, my dear TTC mothers, it is important that you get checked and know the exact cause of your infertility before going about to get any medication. The fact that this Clomid work for Yatiti doesn't mean that it's going to work for you. It might not work for you because the cause of your infertility might not be the same. You understand? So it is important that you even do basic, basic fertility test with your partner, not just you. I always say this, that giving birth to children, pregnancy is a two business kind of thing. It is not just yours alone because it requires your partner, performance as well. So that is why you should not just go about and be working on yourself without even checking your man. So get checked together with your partner to know what is the cause of your infertility before going about to use any medication. And if you want to see other of my videos on how you can boost your ovulation, basic things you're supposed to do, your menstrual cycle and all of that, I've got a lot of videos on my channel. I'll be linking some in the description box so you can watch some of them after this video. You can watch it. And thank you for watching today's video. Subscribe if you have not. Like this video so the algorithm can push it further for other viewers to see. And thank you so much, and I'll see you in my next video. Bye.